Welcome to this webinar on carer awareness in general practice. My name is Dr. Jeannie Knapp, and I'm a GP in Richmond, where I've worked for 15 years, prior to that working in New Zealand. I'm a GP there as well as one of the practice owners, and I also have the pleasure of working at the PHN. Today, we're going to be talking about part 3 of our package on carer awareness in general practice, involving the carer in patient care. So, carers are partners in our patients' care. Carers know the people they care for better than anyone else, and their knowledge is extremely useful in planning patient care and in the identification of problems that require intervention. Engagement and cooperation with carers is an essential part of good patient care. When care is planned without the input of carers, research has shown that outcomes for the patient include more frequent hospital admissions, poor medication management, and lack of integration of care. Cooperation may be needed from carers to effectively implement a patient care plan. Involving carers and listening to their views when devising a care plan is likely to result in much better cooperation and agreement. Respect for privacy and confidentiality, as well as the self-determination of a patient, is critical. However, there are many benefits in involving a carer in information sharing and treatment decisions. Talk to patients routinely about the issues surrounding information sharing and seek their permission for appropriate information about their care and treatment to be shared with their carer. When planning patient care, where possible, ask carers first about any problems they may be having and their views about the best course of action to support the patient. Where a patient is reluctant for all information to be shared, talk through the consequences of this decision. There may be some aspects of their condition that they are comfortable to share. Where a patient does not want any information given to their carer, ensure there is general information on relevant health conditions available. For example, leaflets on medical conditions or the effects of medication. Introduce and record agreements on information sharing prominently in the patient's notes so other members of the care team are aware of them. Ask the carer to feedback any difficulties encountered once a new care plan has been instituted. In some cases, patients lack the mental capacity to make a decision about sharing their personal information with carers. A person should be able to understand the information relevant to the decision, retain that information long enough to make a decision, use or weigh that information as part of the process, and then communicate his or her decision using verbal or non-verbal communication. If this is not possible and you need consent for treatment or a decision around disclosure of information, you may need to turn to the person responsible or guardian. The carer may also hold these roles and functions, but not automatically, so you need to check. So some tips for incorporating carers in care, treatment, and planning. Explore the ideas, concerns, and expectations of carers and other family members. Be aware of the relationship between carer and patient, and consider that they may not always be completely honest in front of each other. Adopt a problem-based approach with carers to clarify and prioritise clinical and non-clinical issues that need to be addressed. Use medical records and information tools to enhance and inform the shared decision-making with patients, carers, and multidisciplinary teams. And include the carer in multidisciplinary case conferences or provide a summary and discuss the outcomes of the conference, if appropriate and the patient agrees. Actively involve carers in the planning and implementation of long-term management plans of those they care for, particularly when developing advanced care directives and discussing aspects of health advanced care planning. Develop holistic and shared decision-making approaches to treatment plans with patients and carers. Coordinate and integrate the agendas of carers and other family members with that of the patient and your own agenda. Enable shared decision-making and agree on management plans. Recognise that carers may need different information and support depending on where they are in their caregiving journey. Consider providing information about carer education, specialised advice or training for specific aspects of their role. For example, advice about lifting or transferring a patient. And what about specifically working with carers of people with a mental illness? The chief psychiatrist provides a guideline providing specialist advice about involving family and carers in the treatment and care of people with a mental illness. The following are key messages and general advice about privacy, confidentiality, and information sharing with carers. The full guideline should be consulted for further information. Families and carers should be recognised, respected, and supported as partners in providing support and care to consumers. Families and carers should be identified and engaged as soon as possible in assessment, treatment, care, and recovery. Services must have clear processes and practices that support open communication with consumers, families, and carers regarding information sharing, privacy, and confidentiality. And services are required to have regard for the impact of mental illness on family members and to assist families and carers to identify their needs, including in relation to the caring role. Families and carers should be engaged in organisational practice and governance. Sharing of information is important to support opening collaborative relationships between clinicians, consumers, family and carers. However, a big challenge for clinicians can be meeting the privacy preferences of consumers and the need to keep family members and carers informed and involved in supporting the consumer's recovery. Victoria's Mental Health Act recognises that carers need information to assist them in their caring role and authorises clinicians to provide this information in specified circumstances. Openly communicating with consumers, families and carers about privacy, confidentiality and information sharing is fundamental, particularly because this is an area where misunderstandings and difficulties often arise. Consumers have the right to privacy and should have the opportunity to decide what information can be shared with their families and carers. Families and carers need information to assist them to provide sufficient support to the consumer. Clinicians will need information from consumers as well as carers and family members to provide treatment and care. In certain circumstances, such as where a family violence or family trauma is disclosed, it may not be appropriate to share information with some family members. Allow for respectful communication with the consumer about their communication preferences. The Mental Health Act also includes specific obligations for clinicians to consult with and inform carers where actions will directly affect the carer and the care relationship. Details of these obligations and when to apply them can be found in the guideline, which is available in the resources section. Families and carers should be provided with general information on available supports and information about the service. Providing general information and hearing from a carer or family does not breach privacy or confidentiality. Another difficult area that clinicians face is medical decision making when a patient cannot consent. In order to consent, a patient must be an adult, able to understand, retain, use, weigh up the information about the general nature and the effect of the proposed treatment and communicate their decision and consent to the treatment. The Medical Treatment Planning and Decisions Act of 2016 provides a framework for making medical treatment decisions when people do not have capacity to make their own decisions. The Act allows people to complete an advanced care directive, appoint a medical treatment maker, decision maker, and appoint a support person. The Act also clearly sets out the process for health practitioners when a patient does not have decision-making capacity to consent to medical treatment. A person may only create an advanced care directive if they have decision-making capacity in relation to each statement in their advanced care directive. There are two forms of statement when a person may include in their advanced care directive. And this is an instructional directive, giving specific instructions about specific interventions, and a values directive, which outlines the values of the person making the directive. If a medical treatment is clinically indicated and a person does not have decision-making capacity, a health practitioner must obtain consent through an instructional directive, or if there is none, obtain consent from a medical treatment decision maker. An adult may appoint a medical treatment decision maker when they have decision-making capacity. If an adult does not have decision-making capacity, the medical treatment decision maker will be the first willing and available person from the list below. And there can only be one medical treatment decision maker at any one time. So the first person on the list is the person that has been appointed a medical treatment decision maker, appointed by the adult when they had decision-making capacity. The second on the list is a guardian appointed by VCAT. And then the next on the list is from the following list of people who have a close and continuing relationship with the person. This might be the spouse or domestic partner, the primary carer, or an adult child, a parent, or an adult sibling of the person.